We know that through the pandemic, those living in long-term care faced significant challenges. The funding announced today by Minister Duclos is a welcome addition to the efforts already in place from the Manitoba government.
It's an agreement that will see millions of dollars flow from the federal government to frontline long-term care in the province after officials say the pandemic identified major gaps within the system.
This agreement could not come at a better time.
Manitoba's Health Minister Audrey Gordon was joined by Federal Health Minister Jean-Yves Duclos to announce $37 million federal dollars would be invested in improving long-term care.
And that's because over the last 2 years, the pandemic has highlighted long-standing issues in our long-term care system, such as gaps in infection control, including against COVID-19, but against other infectious diseases as well.
Minister Gordon says the additional funding from the feds is welcome, but wants to see the Prime Minister open dialogue with provinces to address healthcare spending.
What would be welcomed is for the Prime Minister of Canada to sit down with the premiers and negotiate a fair share of the Canada health transfer. So it's currently hovering at around 22%. And as you know, all the premiers across Canada are calling for that to increase.
Earlier this week, the province detailed how it plans to send residents out of province to speed up access to hip and knee surgeries. Gordon says if federal government funding increased, it would go a long way. Manitoba is asking to increase its Canada federal health transfers to 35%, which would see an additional $192 million in funds flow to the province. The federal minister defended current healthcare spending, saying billions have been invested and funding levels have already reached what the provinces are asking for. He says their focus is on addressing the shortage of healthcare workers by training and recruiting more nurses and making it easier for international professionals to practice in Canada.
Honestly, I believe this is a lot of lip service. Until we can actually see these funding dollars being actually done in place, it is lip service.
Talked about doctors and nurses. I'm going to tell you, these personal care homes are run by healthcare aides.
Debbie Boissonneau with QP 204, the union representing 14,000 healthcare workers, took issue with the announcement and its lack of detail. She says the thousands of support staff who work in these homes are being forgotten and they need to be better supported as well.
I think it's just this federal government and the provincial government need to make healthcare a priority.
In Winnipeg, Modjeski, City News.